All right. So this is strand 4, neonates. Neonates are newborns. So we're going to learn how to take care of newborn babies today and how they grow and develop. So standard 1 is the growth and development of a neonate. So the I can statement says that by the end of this standard, you should be able to describe the growth and development of a newborn baby. Your essential question for this for this standard is, what are the most significant milestones a neonate experiences in their growth and development? So go ahead and pause the video, write down that essential question. Make sure you come back to that essential question and answer that question at the end of the notes today. So make sure you do that. Okay. Go ahead and pause now and then come back when you're ready to move on with the notes. All right. So neonate. Neo means new. Natal means birth or born. So a neonate is a newborn. These are babies ages 0 to 1 month. So babies who are very new. Okay. That's when they're called a newborn, 0 to 1 month. We're going to talk about physical development of the neonate. Okay. Weight and size. The average birth weight of a full-term healthy baby is 7 to 8 pounds. And they're 20 inches long on average. Now, not every baby is 7 to 8 pounds. Some of you probably know what you weighed when you were born. Some of you might have been 7 to 8 pounds. Some of you might have been smaller. Some of you might have been bigger. That's fine. Okay. The other thing to know is that it's very normal for babies to experience slight weight loss after birth. Their intestines are starting to learn how to actually function. And so it's pretty normal for them to be able to lose a little bit of weight after they're born. So just know that that's normal. Sometimes that freaks parents out, but it's actually pretty normal. Okay. Now, if they're experiencing a lot of weight loss, that's a problem. But if it's a little bit, a few ounces here or there, not a big deal. Okay. All right. The baby's head may be elongated or misshapen as a result of their journey through the birth canal. So remember, we talked about how they have the bones in their head that are soft, right? They have fontanelles that squish their head as they go through the birth canal. So sometimes they come out with like a misshapen head. And the baby's head can appear too large for its body because its head is bigger than its body. Okay. The head is 1/4 the size of the baby's total size. So it's 1/4 of their body. Now, if you think about it, if your head was 1/4 the size of your body, that would be very big. Okay. So as we go, like you say, right? As a 2-month-old fetus, their head is about half the size of their body. Then at birth, it's about 1/4 the size of their body. And then as we get older, it eventually ends up being about 1/8 the size of our bodies. Now, I want you to think about this. Does this mean that our heads get smaller as we grow? Go ahead and think about it. The answer is no. It kind of looks like a trick question because it looks like the head is smaller, right? But what actually happens is our bodies get bigger, and our heads get bigger as well, but our bodies end up growing bigger than our heads do. So that ratio changes. Okay. All right. Fontanelles. Something to know is that a child's brain can triple in size the first 2 years of life. That's another reason why the baby has fontanelles, okay? Because their brain triples during the first 2 years. That's a lot of growing, right? Due to this growth, the fontanelles allow expansion. So that's another purpose for the fontanelles. The other thing to note is that the umbilical cord stump, the baby has an umbilical cord stump. This is why we have belly buttons, is because the umbilical cord came from there. So they leave the stump. Usually, this is like a clamp that makes sure that no blood can get through. And the umbilical cord stump will eventually dry out and fall off once that has healed. So it's important that with a newborn, you're not going to try and like take it off or like anything. You just keep it clean and dry to the best of that you can. And eventually when it's healed, it will just dry out and fall off. Okay? That's important to know so that you don't hurt the baby. This clamp is usually left there because the baby's circulatory system is used to sending things out through the umbilical cord and get nutrients through the umbilical cord. But now that the baby's born, the umbilical cord isn't there and isn't attached to mom anymore, so the circulatory system has to figure out another way. So that's why that clamp's there, so that blood doesn't keep trying to go out through the umbilical cord. All right. So in your packet, you should have a Caring for a Newborn. I'm going to post the newsletter that's on Canvas that you can look through to answer those different questions in your packet about how to take care of a newborn. Okay. So go ahead and do that now. That's the end of the notes for this section.